A 10-year-old child has collapsed in the gym of the elementary school. The school nurse arrives and determines that the child is unresponsive. The school nurse then simultaneously checks for breathing and a central pulse, limiting this assessment to which time frame? A. No more than 5 seconds. B. No more than 10 seconds. C. No more than 15 seconds. D. No more than 20 seconds. Answer: B. No more than 10 seconds. A 12-year-old child being evaluated in the Pediatric Intensive Care Unit displays the following ECG waveform. The team interprets this as which arrhythmia? A. Second-degree AV block, type I. B. First-degree atrioventricular, AV, block. C. Second-degree AV block, type 2. D. Third-degree AV block. Answer: A. Second-degree AV block, type I. A 12-year-old is being treated in the urgent care clinic. The mother reports that the child came home from school yesterday with a high fever, vomiting and multiple episodes of watery diarrhea. The healthcare provider obtains a rhythm strip and notes the following waveform. The provider interprets this as which type of arrhythmia? A. Atrial flutter. B. Ventricular tachycardia. C. Sinus tachycardia. D. Supraventricular tachycardia. Answer: C. Sinus tachycardia. A 15-year-old patient is being evaluated during a follow-up visit after being diagnosed with Lyme disease 2 months ago. A rhythm strip is obtained as shown below. The provider interprets this rhythm as indicating which arrhythmia? A. First-degree atrioventricular, AV, block. B. Second-degree AV block, type I. C. Second-degree AV block, type 2. D. Third-degree AV block. Answer: A. First-degree atrioventricular, AV, block. A 2-year-old child arrives at the emergency department with the parents. The child is unresponsive, is not breathing and has no pulse. 2 emergency department providers begin high-quality CPR. Which actions by the providers demonstrates high-quality CPR? A. Compressing the chest about 1 inch and giving 30:2 compressions to ventilations. B. Compressing the chest about 2 inches, providing 1 second ventilations, giving 2 breaths every 15 compressions and allowing full recoil. C. Compressing the chest about 3 inches with no recoil and 5-second ventilations. D. Delivering rescue breaths only because 2 rescuers are present. Answer: B. Compressing the chest about 2 inches, providing 1 second ventilations, giving 2 breaths every 15 compressions and allowing full recoil. A 2-year-old child is brought to the pediatric urgent care clinic by the parent who says the child has had a barking cough for 2 days. During the rapid assessment of the child, the provider hears audible inspiratory stridor. Which common cause of partial upper airway obstruction in children would the provider most likely suspect? A. Epiglottitis. B. Foreign body aspiration. C. Croup. D. Asthma. Answer: C. Croup. A 2-year-old child of unknown weight arrives at the emergency department in cardiac arrest. When preparing to administer medications, which action would be appropriate for the team to take? A. Ask the parent for the last recorded weight. B. Use standard 10 kg dosing for all 2-year-olds. C. Skip weight-based drugs until the child is resuscitated. D. Estimate weight using a length-based resuscitation tape. Answer: D. Estimate weight using a length-based resuscitation tape. A 30-month-old child has been diagnosed with moderate croup. Which medications would the provider administer? A. Nebulized epinephrine only. B. Corticosteroids only. C. Nebulized epinephrine and corticosteroids. D. Albuterol and magnesium sulfate. Answer: C. Nebulized epinephrine and corticosteroids. A 4-year-old child is brought to the emergency department by the parents. Assessment reveals that the child has only gasping respirations and the pulse rate is 65 beats per minute. Which action would the provider initiate first? A. Begin chest compressions immediately. B. Deliver 1 bag mask ventilation every 2 to 3 seconds. C. Apply a non-rebreather mask at 15 liters per minute. D. Prepare for endotracheal intubation before ventilating. Answer B. Deliver 1 bag mask ventilation every 2 to 3 seconds. A 4-year-old child suddenly collapses in the playroom of the facility. A healthcare provider observes the event and hurries over to assess the child. The healthcare provider completes which assessment first? A. Rapid assessment. B. Secondary assessment. C. Focused neurologic exam. D. Detailed physical exam. Answer A. Rapid assessment. A 4-year-old patient presents with tachycardia, tachypnea, cold extremities, and weak pulses. Assessment also reveals an enlarged liver and neck vein distension. The provider interprets these assessment findings as suggesting which type of shock? A. Hypovolemic. B. Distributive. C. Obstructive. D. Cardiogenic. Answer D. Cardiogenic. A 5-year-old child with a history of a chronic neuromuscular disease is experiencing respiratory distress. The child is breathing spontaneously and receiving supplemental oxygen. Which additional intervention is a critical component of airway management for this patient? A. Early endotracheal intubation. B. Continuous albuterol nebulization. C. Airway clearance, e.g., suctioning. D. Heliox therapy. Answer C. Airway clearance, e.g., suctioning. A 6-year-old child is brought to the emergency department. The child has been experiencing extremely watery stools over the past several days. After completing the assessment, the healthcare provider suspects that the child may be experiencing shock. Which type of shock would the provider most likely suspect? A. Hypovolemic. B. Cardiogenic. C. Obstructive. D. Distributive. Answer A. Hypovolemic. A 6-year-old patient is brought to the emergency department after a bicycle accident. Assessment reveals chest pain on inspiration, diminished breath sounds on the right side, and respiratory distress. The provider suspects obstructive shock caused by what condition? A. Cardiac tamponade. B. Pulmonary embolism. C. Tension pneumothorax. D. Massive hemothorax. Answer C. Tension pneumothorax. A 7-year-old child collapses on the playground at school. The school nurse is called to the scene and determines that the child is unresponsive, is not breathing, and has no pulse. The nurse initiates CPR. At what rate and depth would the nurse deliver compressions to this child? A. 80-100/min at about 1 inch. B. 100-120/min at about 2 inches. C. 120-140/min at 1/3 the chest depth. D. 60-80/min at about 3 inches. Answer B. 100-120/min at about 2 inches. A 7-year-old patient with septic shock has received 3 balanced/buffered crystalloid fluid boluses, 60 ml per kilogram, and reassessment reveals capillary refill of 3 seconds, diminished pulses, narrow pulse pressure, and cool, mottled extremities. The emergency response team interprets these findings as indicating which type of septic shock? A. Fluid responsive. B. Cardiogenic shock. C. Warm shock. D. Fluid refractory. Answer D. Fluid refractory. A 9-year-old child is brought to the emergency department because the child suddenly collapsed at school. The child's ECG reveals the following waveform, and primary assessment findings indicate that the child has inadequate perfusion. Which primary assessment finding indicates this? A. Strong peripheral pulses. B. Signs of shock. C. Warm, flushed skin. D. Normal blood pressure. Answer B. Signs of shock. A 9-year-old patient is presenting with diminished breath sounds, bradycardia, slowed respiratory rate, and a low O2 saturation level. The provider interprets these findings as indicating which condition? A. Respiratory failure. B. Respiratory distress. C. Mild asthma exacerbation. D. Hyperventilation syndrome. Answer A. Respiratory failure. A child being cared for in the pediatric telemetry unit suddenly displays the following ECG waveform. The provider prepares to intervene because the child is demonstrating which type of arrhythmia? A. Atrial flutter. B. Ventricular fibrillation. C. Supraventricular tachycardia. D. Junctional rhythm. Answer C. Supraventricular tachycardia. A child exhibiting a narrow complex tachycardia with adequate perfusion is to receive adenosine. The provider would be alert for which result after administering this medication? A. Permanent AV block. B. Transient asystole. C. Severe hypertension. D. Prolonged QT interval. Answer B. Transient asystole. A child experiencing bradycardia with inadequate perfusion despite supporting oxygenation and ventilation is receiving compressions. Despite these efforts, the child's status remains unchanged. Which medication would the emergency response team expect to administer next? A. Atropine. B. Dopamine. C. Epinephrine. D. Amiodarone. Answer C. Epinephrine. A child in cardiac arrest experiences return of spontaneous circulation but is exhibiting signs of post-cardiac arrest syndrome, PCAS. The PALS resuscitation team determines that the child is experiencing a systemic response to ischemia/reperfusion. The team bases this determination on which finding? A. Hypothermia. B. Hypotension. C. Bradycardia. D. Hypoglycemia. Answer B. Hypotension. A child in the pediatric intensive care unit displays the following ECG waveform. The child has no pulse. The resuscitation team interprets this as which arrhythmia? A. Polymorphic pulseless ventricular tachycardia. B. Ventricular fibrillation. C. Asystole. D. Monomorphic pulseless ventricular tachycardia. Answer D. Monomorphic pulseless ventricular tachycardia. A child in the pediatric step-down unit is exhibiting signs of respiratory distress. When assessing this child, which circulation finding might be present? A. Pallor. B. Bounding pulses. C. Warm extremities. D. Hypertension. Answer A. Pallor. A child is experiencing shock. The emergency response team prepares for imminent cardiac arrest when assessment reveals which finding? A. Bounding central pulses. B. Bradycardia. C. Hypertension. D. Warm, flushed skin. Answer B. Bradycardia. A child is experiencing supraventricular tachycardia, SVT, with adequate perfusion and is to receive treatment. Which initial treatment would the provider administer? A. Vagal maneuvers. B. Synchronized cardioversion. C. Amiodarone infusion. D. Adenosine 0.2 mg per kilogram 4 push. Answer A. Vagal maneuvers. A healthcare provider is performing a primary assessment of a child in respiratory distress. The provider documents increased work of breathing when which finding is observed? A. Normal speech. B. Bradycardia. C. Absence of retractions. D. Nasal flaring. Answer D. Nasal flaring. A healthcare provider notices petechiae on the arms and legs while performing a rapid skin assessment of a child with a high fever and respiratory distress. Based on this assessment, which condition should the provider consider? A. Allergic reaction. B. Life-threatening systemic infection. C. Heat stroke. D. Viral exanthem. Answer B. Life-threatening systemic infection. A PALS resuscitation team is preparing to defibrillate a child experiencing cardiac arrest. For which rhythm would this action be appropriate? A. Pulseless ventricular tachycardia. B. Pulseless electrical activity. C. Asystole. D. Sinus bradycardia. Answer A. Pulseless ventricular tachycardia. A provider is assessing a child with suspected shock. Which statement correctly describes hypotension and shock? A. Hypotension is an early, reliable sign of shock in children. B. Hypotension rarely occurs in pediatric shock. C. Hypotension is not a consistent feature of shock presentation in children. D. Hypotension must be present to diagnose shock. Answer C. Hypotension is not a consistent feature of shock presentation in children. A provider is caring for a 4-year-old child in the urgent care clinic. Primary assessment reveals difficulty breathing and an oxygen saturation of 91%. The provider administers oxygen by nasal cannula with the goal of improving the child's oxygen saturation to what percentage range? A. 94%, 99%. B. 90%, 93%. C. 88%, 92%. D. 100%, 102%. Answer A. 94%, 99%. A provider is forming an initial impression of a child using the Pediatric Assessment Triangle, PAT. For which part of the PAT may the provider use the mnemonic TICLS to assess the patient? A. Work of breathing. B. Circulation to the skin. C. Appearance. D. Level of consciousness. Answer C. Appearance. After ROSC, a child is experiencing post-cardiac arrest hypoperfusion. The PALS resuscitation team would administer which element to restore intravascular volume and optimize preload? A. Hypertonic saline bolus. B. Dopamine infusion. C. Albumin 5% bolus. D. Isotonic fluid bolus. Answer D. Isotonic fluid bolus. An 11-year-old child develops ventricular tachycardia with a pulse and inadequate perfusion. The PALS team would prepare the child for which intervention? A. Unsynchronized defibrillation. B. Synchronized electrical cardioversion. C. Rapid adenosine push. D. High-dose epinephrine. Answer B. Synchronized electrical cardioversion. An 11-year-old soccer player is brought to the emergency department. After a quick assessment, the team realizes this patient is experiencing a severe asthma exacerbation. Which medication would the team administer immediately? A. Intravenous magnesium sulfate. B. Continuous epinephrine nebulization. C. Albuterol with or without ipratropium bromide. D. Systemic corticosteroids only. Answer C. Albuterol with or without ipratropium bromide. An 8-year-old child being treated in the emergency department has significant respiratory distress. The child also exhibits hives, wheezing, angioedema, tachycardia and dyspnea. The parents state that the child, who is allergic to peanuts, had eaten some popcorn that had peanuts in it. The team initiates care, preparing to administer which agent first? A. Epinephrine IM. B. Diphenhydramine 4. C. Albuterol nebulizer. D. Methylprednisolone 4. Answer A. Epinephrine IM. An advanced airway was placed in a 5-year-old child. Which action would be most appropriate for the team to take to confirm correct placement? A. Observe for unilateral chest rise only. B. Auscultate over the lungs and epigastrium, observe bilateral chest rise and confirm with capnography. C. Assume correct placement if oxygen saturation improves. D. Rely on condensation in the tube as the sole indicator. Answer B. Auscultate over the lungs and epigastrium, observe bilateral chest rise and confirm with capnography. An unresponsive 7-year-old child with no pulse is brought to the pediatric urgent care center by his parents and CPR is initiated. The cardiac monitor reveals ventricular fibrillation. Which action would the PALS team take first? A. Administer epinephrine 0.01 mg per kilogram 4. B. Intubate the patient immediately. C. Begin synchronized cardioversion at 0.5 J/kg. D. Initiate defibrillation with 2 J/kg. Answer D. Initiate defibrillation with 2 J/kg. Assessment of a 3-month-old infant admitted with respiratory distress reveals fever, grunting and a wet, junky cough. The infant's parents said the child had a recent respiratory infection with a fever. A rapid respiratory syncytial virus, RSV, test is positive. Which condition would the provider most likely suspect as the cause? A. Asthma. B. Bronchiolitis. C. Pneumonia. D. Croup. Answer B. Bronchiolitis. Laboratory tests are ordered for a child who has been vomiting for 3 days and is diaphoretic, tachypneic, lethargic and pale. Which test would the provider use to determine the adequacy of perfusion and oxygen delivery? A. Serum potassium. B. Blood urea nitrogen. C. Lactate. D. Serum glucose. Answer C. Lactate. Primary assessment of a 10-year-old child reveals septic shock. As part of the secondary assessment, if not already done as part of initial sepsis care, laboratory testing is completed to evaluate the child's status. Which laboratory tests would be ordered for this child? A. Complete blood count, CBC, lactate level and blood cultures. B. Serum electrolytes and creatinine only. C. Arterial blood gas only. D. Thyroid panel and coagulation profile. Answer A. Complete blood count, CBC, lactate level and blood cultures. The emergency response team is providing care to a preschooler who is experiencing shock. The primary goal, common to all types of shock, is to restore a favorable balance between tissue perfusion and metabolic demand with a focus on what? A. Blood glucose control. B. Oxygen delivery and oxygen demand. C. Temperature regulation. D. Acid-base balance. Answer B. Oxygen delivery and oxygen demand. The PALS resuscitation team is providing care to an intubated child in cardiac arrest. Which of the following can be used to monitor the adequacy of the team's chest compressions? A. End-tidal carbon dioxide levels. B. Respiratory rate. C. Blood glucose level. D. Serum potassium level. Answer A. End-tidal carbon dioxide levels. The PALS resuscitation team notes the following ECG waveform and the child does not have a pulse. The team prepares to intervene to address which arrhythmia? A. Sinus bradycardia. B. Atrial flutter. C. Torsades de pointes. D. Junctional tachycardia. Answer C. Torsades de pointes. The PALS team is providing post-cardiac arrest care to an 8-year-old child in the Pediatric Intensive Care Unit. Which intervention would the team implement to achieve the primary goal of post-cardiac arrest care, after assuring adequate oxygenation and ventilation? A. Induce hypothermia to 32 degrees Celsius in all cases. B. Ensure adequate mean arterial pressure. C. Administer high-dose steroids. D. Start prophylactic antibiotics. Answer B. Ensure adequate mean arterial pressure. The PALS team leader is conducting a debriefing session with the team. Which topic would the team leader most likely address during the session? A. Discussion of the pros and cons of the interventions carried out. B. Personal grievances unrelated to the event. C. Scheduling of the next staff meeting. D. Vacation requests. Answer A. Discussion of the pros and cons of the interventions carried out. What is considered inadequate perfusion when assessing/caring for a pediatric patient with an arrhythmia? A. Bounding peripheral pulses. B. Warm, dry skin. C. Hypertension. D. Acutely altered mental status. Answer D. Acutely altered mental status. What is the correct 4/IO dose of epinephrine for a pediatric patient in cardiac arrest? A. 0.1 mg per kilogram every 3 to 5 minutes, max single dose 10 mg. B. 1 mg total every 10 minutes, regardless of weight. C. 0.01 mg per kilogram every 3 to 5 minutes, max single dose 1 mg. D. 0.001 mg per kilogram every 5 minutes, no maximum. Answer C. 0.01 mg per kilogram every 3 to 5 minutes, max single dose 1 mg. Which action would the PALS team initiate to manage increased intracranial pressure in a pediatric patient? A. Place the head flat and rotate side to side. B. Trendelenburg position. C. Hyperflex the neck toward the chest. D. Maintain the head in midline position. Answer D. Maintain the head in midline position. While performing a rapid assessment and formulating an initial impression using the Pediatric Assessment Triangle, PAT, the provider assesses the child's circulation. Which information would be important to consider? A. Skin flushing, evidence of bleeding, skin pallor or gray/dusky color. B. Pupil size and reaction. C. Capillary refill on the forehead. D. Presence of distal pulses only. Answer A. Skin flushing, evidence of bleeding, skin pallor or gray/dusky color.